Good morning everyone. Today I will be presenting on electronic health record alongside my friends KIRTHIKA, SURITHA and farhat, and I am Nurin, Auni, Najwa. So what is EHR? EHR is an electronic health record and it is an electronic version of a patient's medical history that is kept up to date by the provider. It contains all of the important administrative clinical data related to that patient. EHR can help clinicians operate more efficiently by automating information access. EHR can also directly or indirectly support other care-related tasks such as quality monitoring, outcomes reporting, and evidence-based decision support.
Moving on to the key features of EHRs. So firstly, the usage of EHRs allows patients' data management. What this means is that the usage of EHR is able to store comprehensive information about a particular patient, and this includes the demographics of the patient, the history of the patient, medications, allergy, and past lab results of this patient. Not only that, it is also able to give real-time access and updates across different departments in a medical setting. Secondly, clinical decision support, also known as CDS. So the feature of this is that it is able to alert the practitioner who is attending the patient about allergies, drug interactions, abnormal lab results of this particular patient previously. So the use of EHR enables the medical practitioner to know about the patient harm that can come to the patient with previous health records that has already been recorded through EHRs. Lastly, EHRs are interoperable and it also gives secure data sharing. So it enables secure sharing of patient data between different healthcare systems. So like what I've previously mentioned, when a patient has been previously admitted in hospital A and today being admitted in hospital B, the two healthcare providers are able to interact with each other and provide relevant information for hospital B to know about this particular patient. And also it promotes coordinated care, especially in referrals or emergency cases where situation is already at the very peak and patient has to be attended very quickly. Now, let's move on into why EHR are so important in modern healthcare. Firstly, EHR enhances patient care. They help doctors make better clinical decisions in real time to access a patient's medical history. This reduces any medical errors and improves the overall quality of the treatment. As you can see here in figure 1, there is a doctor here checking the digital records on a tablet where all the patient's information can be obtained from the tablet itself. This makes information of the patient a lot more accessible and easier for the clinical doctors to check for patient history and medical records. Not only that, EHR also improves the workflow and data management of the whole system. So how it does this is that the patient information are all centralized, and this makes documentation, scheduling, and billing much easier. Not only that, it also saves time and increases the productivity, which is the main goal of health informatics when we are dealing with patients. Lastly, EHR supports coordination and patient safety. What this means is that it allows for smooth communication between different health providers in different clinical settings. So for example, a patient in hospital A has already has medical records in this hospital. So for example, if the patient is being admitted to another hospital today, these two hospitals can actually interact with each other and share the digital records because of the availability of EHR nowadays. So this is how EHR is being implemented and how it is so important in helping healthcare providers find information about a patient in a much easier and accessible way.
The implementations of EHRs come with a lot of benefits, and the first one is giving patients accurate, current and comprehensive information at the point of care. The second one is making patients' record easily accessible to promote a better, coordinated and effective care. This is because all of the patient's information that are needed are already in that system. The third one is safely exchanging electronic data with patients and other medical professionals. Other than that, the EHR also benefits the person, us, in a way that is, they assist healthcare professionals in making safer, more accurate diagnosis and lowering medical errors. Next one is enhancing communication and engagement with the patients and providers, and enhancing the convenience of healthcare. Other than that, it also makes prescription more safer and dependable. It also helps enhancing the privacy and security of patients' data. Other than that, the benefits of EHR is to help providers improve productivity and work-life balance. The last one is EHR could help with reducing costs through decreased paperwork, improve safety, and reduce duplication of testing and improve health. That's all from me. Thank you.
Hi everyone, my name is Farhat and today I'll be explaining about the EHR implementation. Okay, so basically EHR implementation is the process of setting up electronic health record system in places such as hospitals and clinics. Also, this system helps move patient records from paper to digital, making it easier to manage and also to make it more efficient. Basically, EHR implementation includes several steps, in which the main steps are adding patient records and health data into the system, also automating tasks, also to reduce human labor and the workflow, also informing the staff and patients about the new system, and also about training medical staffs on how to use the system and also on how to solve the problems. Also includes cleaning and validating all data before moving it into the new system, and also introducing patients to the new digital portal and offering support. All in all, we can say that EHR improves efficiency and also it saves time, and also it makes healthcare system better for everyone. Yeah, thank you.
My name is KIRTHIKA and I'm going to talk about the future of EHR. So EHR is a technology that transforms how healthcare is delivered around the world. So nowadays EHR already helping the doctors and nurses to keep track of their patients' information digitally. Okay, now let's look into the future of EHR. First of all, AI intelligence, artificial intelligence integration, which is set to revolutionize EHR by enhancing decision making and patient care. So the AI algorithms can detect early signs of diseases by analyzing imaging clinical notes, and also it lowers the cost and clinician workload. It supports personalized treatment recommendation and patient decision support, improving both quality and safety care. Next of all, cloud computing. Cloud computing offers enhanced data accessibility, scalability, and cost efficiency. So it protects sensitive patient information from cyber attacks and potential breaches, such as, for example, the law of HIPAA, where it protects the patient info and with just the doctor and nurses in charge. Next of all, telehealth integration. Telehealth integration is accelerated by recent global events which continue to shape the future of healthcare delivery and making remote patient care more efficient and accessibility. So nowadays doctors will have real-time access to patient records during virtual visits, making remote care as effective as in-person communication. So patient will also use the same app to connect with their healthcare providers and health appointments. Wearable device integration. EHR will increasingly incorporate the data with wearable data device. So it provides a more holistic view of patient care, health, supportive preventive care, and continuous monitoring, such as the real-time healthcare like a heart rate or respiratory rate, oxygen level. So these data will be recorded in the patients beyond the clinical visits and enable to early detect diseases. Nowadays, wearables have been used to detect atrial fibrillation and monitor asthma symptoms, which alerts and trigger timely medical interventions. Last of all is the big data analytics. So, analyzing this data with advanced computational methods helps uncover patterns and insights that are beyond the human cognitive capacity. So, it is applied to EHR, which improve population health management, reducing diagnostic costs, improving treatment procedures, and analysis records. So, it supports research by linking medical or clinical data with variable of information from creation of the medicine. So it is shown that future of EHR is full of potential. So that's all from me. Thank you.
Hi again. Okay, so we can say that since EHR was introduced, the quality and also the accessibility and continuity of patient care have improved a lot. Also, healthcare workers can now make better decisions because they have accurate data and also real-time access to patient information, and also the workflow is way more easy. Also, we can say that EHR allow easy sharing of information between hospital and also in clinics, which helps in better coordination of care. However, it's important to keep checking and also improving the system to fix any usability or any issues and make sure it meets both clinical and also administrative needs. So we can say that EHR has made a big step forward in healthcare, also helping provider making smarter decisions and also build a stronger relationship with patients. Thank you.